Hi everybody, welcome back to Midnight Mental Talk, and tonight we are going to be telling you about a controversial treatment plan. That treatment plan is called Electroconvulsive Therapy. Before we go on, I'm going to direct it over to Leanne, and she's going to tell us what exactly electroconvulsive therapy is. Leanne, take it away!
Well, Adrienne, electroconvulsive therapy is actually where they send currents through the brain to intentionally cause a seizure in the patient. It's believed that by doing this, it can change the chemistry in the brain, which can quickly reverse some symptoms of a mental illness. But did you know that this treatment has been around since the 1900s and was created by Ugo Cerleto and Lucio Bini around 1937?
So, how exactly did Ugo come up with the electroconvulsive therapy? Well, let me tell you. He actually got the idea from a pig. If you believe it, you heard it right, he got the idea from a pig. According to Wikipedia article, and yes, we know they're not reliable, but it's a pretty good article. A butcher shop didn't have the cut of meat that he wanted, so he asked the butcher to go out back and get him the correct kind of meat that he had wanted. So the butcher went back to give him the fresh piece. So he decided to witness the butcher doing this, and the butcher sent shocks to the pig in order to stun them into a seizure. This made it easier for the butcher to butcher the pig in order to give Ugo the cut of meat that he wanted. Anyway, and a part of his theory was that people who had epilepsy were immune to schizophrenia, which he thought that the seizures were preventing the illness. So eventually they did discover that that was untrue. However, this was a very monumental day in psychiatry. So now that you know a little history, let's talk about the treatment, how treatment works.
Now, the treatment itself is relatively short. It usually lasts about 5 to 10 minutes. So prior to the nurse putting the electropads behind your head, you may have a short physical exam. You'll get an intravenous line and anesthesia, and something. And your doctor may suggest to adjust your diet and avoid certain foods and drinks prior to treatment. This is to reduce reactions, I guess. Luckily, we have come a long way, though. Originally, a person used to be awake during the procedure. Yikes. And they experienced all the pain and shock involved. But now the patient is put to sleep and also given muscle relaxants.
So you're telling me all that they do is press a button and send shocks to your head?
Actually, yes, they do. Once you are under, the doctor presses a button and it sends the electric shock through your brain. That produces a seizure that typically lasts about 60 seconds.
So can you explain to me how that even helps with mental illness?
To be honest, doctors aren't even sure why electrotherapy works. They believe it shakes up the cells in your brain enough so that it's kind of like a puzzle. You shake up the box and all the pieces fall back to where they should have been in the first place. And you don't have to do the puzzle anymore. It's actually really fascinating.
So in order to qualify for electroshock therapy or electroconvulsive therapy, there are some mental illnesses a person could have. And that list includes severe depression, acute mania, some schizophrenic syndrome, and even some people who experience suicidal thoughts use ECT because they are actually impatient to wait for the medication to work that they were prescribed.
If you qualify, how long do the treatments last? Typically, treatments last between 3 to 4 weeks, with 6 to 12 treatments, depending on the severity of the illness. Like all treatment, it really depends on how quickly your brain chemistry responds to treatment. You may feel a lot better after 3 treatments, while the person sitting next to you may not feel better until the 12th treatment. Everybody's different.
Even though ECT is a lot safer than it was over 100 years ago, there are still risks and side effects to the treatment. Some of those risks of treatments are such as mild as short-term memory loss to, of course, death. Like mentioned before, you are given muscle relaxants, you are put under anesthetics, and as well as given a mouth guard.
Basically, what it comes down to is you do a complete exam. I mean physical exam. Write out a family history, get your heart checked, for obvious reasons, because it is possible that your heart may not be able to handle the ECT. While death is rare, with any kind of treatment like this, death is always a possibility.
Wow, that sure is a lot of information. It certainly does seem like a positive form of treatment, and if you think you qualify for this treatment, I would strongly suggest to talk to your doctor at the next appointment that you have, and even just pass it along, even if you feel like your medication hasn't been working for you and you've been on it for quite a while. It's entirely possible that it could work for you. Anyway, thanks for watching. Leanne?
Thanks for joining us for another Midnight Mental Talk episode. We hope you subscribe to our channel for more interesting videos coming your way next week and the week after that. Please click like if you enjoyed this and comment below. We would appreciate your feedback. That's all for now. We'll see you next week.